This gel is used to protect skin ulcers, burns, or wounds from irritation so that the skin can heal properly. It can also help relieve itching and pain from various skin conditions. Hyaluronate is a natural substance found in your body and works by forming a protective layer over the affected area. The recommended daily dosage and optimal timing for using this gel should be discussed with a healthcare provider. When using hyaluronate sodium He-Selpeg gel, make sure to only apply it to the skin. If you're using your hands to apply the gel, be sure to wash your hands before and after each use. Clean the affected area as directed by your doctor before applying the gel. Gently apply a thin layer to the affected areas of skin, usually 2 to 3 times daily. If your product is a liquid suspension, remember to shake the container well before each use. The frequency of application depends on your medical condition and how you respond to the treatment. Using this medication regularly will help you get the most benefit from it. Try to use it at the same times each day to help you remember. If your condition does not improve or if it gets worse, be sure to inform your doctor. The medication hyaluronate sodium He-Selpeg gel has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. Although it is rare, a severe allergic reaction to this drug can occur. If you notice symptoms such as rash, itching, swelling, severe dizziness, or difficulty breathing, seek medical help immediately. This is not an exhaustive list of potential side effects. If you experience any other effects not mentioned here, consult your doctor or pharmacist for advice. If you are in the US, you can call your doctor for medical advice on side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice on side effects, or report them to Health Canada at 1-866-234-2345. Before using hyaluronate, it's important to talk to your doctor or pharmacist if you have any allergies or medical history. If you are going to have an MRI test, make sure to let the testing personnel know that you are using this product. Some brands of this medication may contain metals that can cause serious burns during an MRI and should not be used before MRI imaging. If you are pregnant, this medication should be used only when clearly needed, so make sure to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. When using hyaluronate sodium He-Selpeg gel, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include certain disinfectants, such as benzalkonium chloride. It's essential to discuss any concerns or questions about potential drug interactions with your healthcare provider before using hyaluronate sodium He-Selpeg gel. Remember to follow your doctor's recommendations for the best time to take this medication and the appropriate daily dosage. If this medication is ingested, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, seek immediate medical attention by calling 911. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It's important not to share this medication with others, as doing so may spread infection. This medication has been prescribed specifically for your current condition, so it's important not to use it later for another skin condition unless instructed to do so by your doctor. Some brands of this medication may also contain other ingredients, such as aloe vera and allantoin, which can help provide moisture and soothe the affected area. If you have any questions about these ingredients, be sure to ask your doctor or pharmacist. If you forget to take a dose, take it as soon as you remember. If it's close to your next dose, just skip the missed one. Take your next dose at the usual time. Don't take extra to make up for the missed dose. Remember to store hyaluronate sodium He-Selpeg gel at room temperature and keep it away from children and pets. When you no longer need the product or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so. And remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.